we'll move on to the second fireside chat to talk about the work done in Kenya and the project that was co-created with the Kenya Red Cross. So I'm inviting Mary, Roy, and Jared on the virtual stage and leave the floor to Jared to moderate.
Thank you so very much, Louise. As always, it's always a pleasure, being part of this conversation. And, it gives me a lot of joy to see the growth that has been realized over the years. And I remember when we started the conversation of having Techfugees make inroads to Africa and East Africa, to be specific, that 4 years ago. And there were very few people, to talk about. But currently, see what's happening. We are talking of Techfugees Uganda. We are talking of Techfugees Nigeria. And this is just beautiful. It's amazing, and I'm very happy, and even more delighted that personally I've been part of this journey. So to everyone, my name is Jared Owuor. I am the Regional Operations Officer at Samuel Hall. I lead research operations for the organization in Africa. And as an organization, we are a social enterprise specializing in research, policy design, monitoring, and evaluation, with a focus on context affected by migration. Now, within this space that we are having a discussion on, our main interest is to support development of research methodologies and tools with a focus on emerging technologies and their impact on refugee support services and systems. Now with me, two very amazing people, Mary Monyuki from Techfugees Kenya, and of course, Roy Ahawo from the Kenya Red Cross Society. We would like to just hear from them. I know there are a lot of things that are going on, and especially from the Techfugees angle. I know I'll start with Mary. A lot has been going on since 2019 when we first had a one-of-a-kind hackathon in Africa, and that has also created a lot of openings for other activities. Would you maybe tell us what aspects that Techfugees Kenya is looking at in terms of interventions around health and the challenges that you're trying to address, and especially around features of the solution that you're trying to put in place? And then later, once you've given that insights, we will talk to Roy and also maybe get to know more from him about the significance that this campaign, Take Down Borders, is to Kenya Red Cross, and what are they looking forward to?
Thank you so much, Jared. I'm so excited to be here. My name is Mary Monyuki. I'm here to represent the Techfugees Kenyan chapter. I launched the chapter 1 year ago. It has been an amazing journey, as Jared says, since 2020. The chapter here basically was founded in 2017. It launched in 2020, and we have a team members of 7 as of now. Our focus has been mainly in the health, in partnership with the Kenya Red Cross, and education in partnership with Buffalo Grid. Some of the partners we've worked with have entailed, Samuel Hall, Kenya Red Cross, Oracle, Google, Kakuma Ventures, and Buffalo Grid. The events we've hosted, 1 hackathon, which I'll speak about in the next few seconds, and 3 meetups and other event invitations we've received is from EU Africa Hackathon and TAN with refugees. The skill sets in our teams have basically been product development, fundraising, and project management and communication, and you can learn more about this on the link. So basically the situation in Kenya about refugees, we have over around 500,000, 500,000 refugees in Kenya. Host locations have been in Dadaab and Kakuma and some of the urban areas as well. Some of the countries of origin has been in Somalia and South Sudan. As you can see, the placements of the refugees will be some in the northern part of Kenya, where Kakuma is, and that's where we've centered most of our work in for the last 2 years, and in the eastern part of it where we have Dadaab. So here we are, particularly to answer your question, Jared, about the e-health project that we've been working with Kenya Red Cross. Innovation focus on improving health reporting and clinical condition management. In 2019, we hosted a hackathon in partnership with at the iHub. That's where it was hosted, major incubator here in Kenya. And the event was in partnership with Kenya Red Cross, Samuel Hall, Google. The event was a 3-day hackathon, and the winners of the hackathon was the team called Faceless Hackers, who pioneered the initiative behind this e-health project. So really, what is the e-health project? The Kenya Red Cross team, we co-created this problem statement with them, and they were looking for innovative solutions to enable the local health workers and community leaders to provide early health warnings and avert more serious health problems. These are the team members of the Faceless Hackers, and the solution which was developed from here was a USSD application, a mobile application, and the web dashboard as well. So this is just a quick layout of how the 3 kind of solutions were. We have the web dashboard, which is where the clinical conditions are being received from the Kenya Red Cross side. And then we have the USSD. So for those who are in Kenya, you can basically, access via this code. And then the mobile application part of it, which came in very handy in terms of location specifics, since the USSD is not able to do that. So we had a user testing in October. Some of the partners as well who we've worked with were very, supportive through this process, and also talking about needs assessment. So one of the guiding principles of Techfugees on, tech is just a tool. I think it was very important to us to ensure that we are solving needs which are relevant. So coming from the needs, what are the needs of the people, and how do we use tech to solve it, but not, what kind of tech we can apply here, being very strategic in this solution. So we had our pilot launch in November on Facebook Live. So I will now invite Roy, who we work together with in this project, and then he'll be able to share insight on how the situation is in Kakuma and how this was important for the Kenya Red Cross team.
Thank you. And maybe before Roy speaks, Roy, I know that in the last 1 year there must have been some changes in terms of the initial concerns in how the app, let's say, has managed to address some of the linkages between the communities, the community health workers, and the health providers. I don't know, is there something, as you take on to answer the question of what, why, and how, has there been any improvement or change that maybe as an organization, Kenya Red Cross Society has noted from the app initiative since it was launched?
Thank you very much, everyone. Yes, but just to answer your question, I believe that from the time that we were able to launch the pilot project in Kalubei, there has been a tremendous improvement in terms of the uptake of the solution compared to the community members who didn't use the solution, because we intended to have around 500 people for the pilot, but the number of people who subscribed or who are able to use the pilot surpassed to 3,000. So it shows you that there is more needs for constant communication for the health issues that are existing within the camps to the relevant authorities or to the organizations that deal with these issues. Because just as Maria said, that the solution was actually looking at how are we able to link community members who have some of the clinical conditions, and how fast can that be reported to organizations or through the ministry that are dealing with these issues. So if you look at that, if you look at the aspect of using this specific technology versus community members who probably didn't have the opportunity to use this, you realize that there is a change and there is a constant feedback that the solution actually provided an upper hand for community members to be visited by the health workers and also the community volunteers. And this has enabled them to get timely assistance to some of the issues that they were facing. So basically, what is existing in the camp right now is like there is no some sort of order where the health workers are able to trace communities or the refugees that have the existing conditions. So in difficulty of finding these patients, it becomes a mess for even the Kenya Red Cross through the programs, health programs that they have in the camp. But when you look at a solution that tags you along to the specific camp and the specific household, it's easier for the health team to be able to trace and assist the communities in good time. The other area is delaying in reporting, because within the camp, there is surveillance team that are able to collect the information that of the different illnesses or diseases that exist within the camp, and they report this through the ministry for appropriate action to be taken. And this solution provides that niche of gap, because now it's able to link the reporting sides of the diseases that are existing to the overall platform. And within Kenya, we have what is called the District Information Management System, District Health Information Management System. And this solution is able to feed information to this and appropriate inform on the policies that are to be taken within the camp area. The other area is how health workers are able to report on these issues, because we find that there exist very few health workers, and with multiple cases arising, it becomes very difficult. So if you do not have a solution that links or allows the community to report some of these issues in due course, it creates overburdening to the few health workers that exist in the camps. So we look at the USSD versus the mobile application platforms that we are providing to the refugees and to the community members that are existing within the camp. So maybe if you look at the next slide, is like the types of achievements that we are able to come up with. Number one is around the numbers. As I have told you, there's been an increase, or there's been an uptake of the solution within the camp. This shows that more people are seeing the value of using the platform to be able to report cases of illnesses within the camp. The other area is around the type of cases that have been solved or have been appropriately looked into. And as you can see from here, we had around 350 cases reported via the application. And this was actively dealt with in terms of the community receiving the assistance from the public health officers and the community health workers in terms of the specific needs that they had.
Excuse me, Roy, maybe if you just had, because in the interest of time, maybe if you can just allow me to direct this question to both of you, because I think the achievements are pretty much clear, and the desire and the need to put in much more resources and efforts in terms of covering a larger population is actually very clear. But the question maybe someone would want to know is, could you explain how the funds from the crowdfunding campaign will support the desires of your of your day-to-day work? I can start with Roy, and then Mary can wrap it up.
Thank you for that. Looking at the resource mobilization we are looking at getting is, we are looking at three aspects. One is, how are we able to capacity build the community health workers and give them much more ability to be able to deal with the issues that they face at that level, because they are the first contact people to the communities. So how are we able to capacity build them to have the correct knowledge and the correct ways to be able to deal with the diseases that they face? The second aspect is looking at how are we able to support the infrastructure development so that the system is much more advanced in a way that it feeds directly to the Ministry of Health systems, so that we have a broader perspective that is able to be deployed in any part that we have the refugees, because as it is right now, we are limited to the areas that we can deploy the solution. The other aspect is we need to bring different stakeholders into the table and discuss some of these issues, and all these require resources so that we get the information and the buyout from different stakeholders on this process. Thank you, Mary.
And Mary, while at it, as you summarize, I know there has also been some progress in terms of scale up, and you're going beyond Kaloboye and touching into the urban component, and there's a place you have identified in Nairobi, informal settlement. Maybe say, as you touch both the two, in terms of the proper utilization of the fund that will come from the Take Down Borders campaign.
Sure, thank you, Jared, and thank you, Roy, for those rich insights. So after running the pilot launch for the last 6 months, we had it was very successful in terms of the achievement that Roy has already mentioned. And we are now scaling up the project to Mukuru, which is an urban slum in Nairobi, around Nairobi here in Kenya. And there is actually the need to scale it up there, and that's why we really identified that location. And of course, thinking of scaling up, there are a lot of costs. I remember during the pilot launch, a lot of costs came in. If you think about the infrastructure cost, where is the USSD running? And we had our partner here, Africa Talking, who hosted us, but of course it needs funds to run that, and the technical software aspects of it and integration of the database as well. And also, some of the subsidies for the volunteers who we work with. You can imagine pulling through a solution and it's, really helping people on the ground. So that's what we are looking at. And of course, as this campaign is running for the Basefugees project, I'm looking forward to research and publishing report with some of the, research organizations like Samuel Hall, and also, the technical development of Techfugees side of it. So these are kind of the aspects that we are confident with the solution, because we've seen it work. We've seen cases resolved, health cases resolved firsthand and quickly, as Roy says. So yeah, we are really calling everyone to help us in this campaign to ensure that we're able to scale this project to Mukuru.
Thank you, Mary, for your contributions. Thank you, Roy, for your very insightful contributions as well. I know we're running out of time, but just allow me to mention one last comment. One thing that also makes this intervention much more interesting is the type of community that it's targeting. Somebody might just maybe assume that it's only speaking about, refugees, but just to maybe let you know, in Kaloboye, for example, which is an integrated system, it is targeting both the host communities and the refugees who are in need, of healthcare access. And of course, now that it's rolling out into the urban center, same thing. Many people who are host members and the refugees will benefit from this solution. And of course, it is just, an appeal to, make sure that we put our best foot forward to support those that are in need. I'll get this back to you, Louise, so you can continue with the other components of the session. Thank you.
Thank you very much, Mary, Roy, and Jared. And I want also to take the opportunity to thank the Faceless Hackers team, and especially Alan and Cliff, who couldn't be there today, but who have been working during 2 years as well as volunteers on this pilot until it worked. So congrats to them for their efforts.